Dr. Michael Tillman here, Tillman's Body Talk. Today we're going to talk about IT band syndrome, the dreaded IT band. Now, first of all, you need to understand 70% of hip pain is low back. So I want you to watch the low back video and do the press-ups first and rule it out. But you other 30% that actually have IT band syndrome, what I want you to do is I want you to understand it. It's more common in women. Why? Because we teach our women to sit with their knees close together or cross one leg over the other. So if you watch a young woman walk, she's got a wiggle, she moves, right? And as a woman gets older, she loses her wiggle, right? And that's because the outside of the hips are getting tighter and tighter and tighter. So if you watch an old woman walk, her hips don't move at all, and she hurts, and her feet are real close together. And that's why they fall so easily. If you were to stand next to them and push them from the side, they'll fall because their feet are, it looks like someone tied their feet together. So we're gonna teach you how to fix that. It doesn't help if I stretch it and they constantly go back to sitting and crossing their legs and sitting and crossing legs, because it's tightness over time, it's pressure over time. And that's why posture, I keep saying, is 50% of the equation. Like, we have to address that. You have to understand why it's happening and not just trying to make the pain. So we're gonna show you the first stretch for your IT band. The first stretch is an unloaded stretch. What is the IT band? It runs on the outside of the hip, and it's a tendinous structure that goes all the way outside. In someone who's tight, as I start touching, it really hurts, and it really hurts at the top. That's why women can't sleep on their sides, is because it's gotten so tight. And again, that's why their hips aren't moving, they don't wiggle, because it starts compressing. Eventually it's gonna wear the bone out, get bone on bone. So how do we stretch it? We start pulling up like a rope. She's got a strap, you could use a belt tied around your shoe, and then she keeps it and she pulls it over. She's keeping the knee locked the whole time. She's pulling it with the opposite hand. She goes up, she goes back down, she climbs again. How often do you want to do this? You want to do this 10 to 15 reps, probably 3 times a day. This is a harder stretch because you have to lie down to do it. So I'm going to teach you a standing stretch as well, and a kneeling stretch. The second stretch is a standing stretch. This is a standing IT band stretch. Again, your IT band is here. So what she's going to do is she crosses the front leg over, she bends the front knee, and she'll lean her hip to my hand, right? You don't want to push your bottom out when you do this. You want to go straight to the side. There is a risk of you feeling the tendon pop over the bone. That's very painful. If you hear this popping like a rope, it's a tendon popping over the bone. Don't do this stretch, because then it'll just get aggravated and it'll hurt more and more. So she leans to the side, she pushes, and that's gonna stretch this. What I'm gonna show you now is a kneeling version of IT band stretch. She's got a pad, you can use a pillow. She kneels, lunges on it, and then she leans to the side. She can push to the side, and you'll see she's stretching this whole IT band to take pressure off the outside of the leg. And she'll go back. 3, and how often do you want to do this? Just like the standing, since they're easier to do, you can do this 10 reps every 2 to 3 hours, or 6 to 8 times a day. That's IT band syndrome. You can see we have different versions. We have a lying down stretch, which is probably less often because it's harder to do. We have a kneeling and a standing stretch that are easier, so you should do those more often. Anytime you're tight, you want to stretch a little bit throughout the day, so think every 2 to 3 hours, 6 to 8 times a day, a progressive stretch getting harder and harder. The stretch is only going to help you if you also change the way you sit, right? Sitting is 50% of the equation. If you sit and your feet are constantly together and you're constantly crossing your legs, you're going to continue to get tight again. Understand, that's why women get bone on bone hips. That's why they start wearing out. That's why they can't walk very long. That's why they fall. And I need you to understand the why. Just getting flexible is not enough. You have to understand the habits you're doing that are causing you to get tight, so you just don't constantly get tight, or it constantly comes back. Again, that's Mike Tillman with Tillman's Body Talk on IT band syndrome. I want you to like, subscribe, and please share this.